day everyone! As we progress in an era wherein all things are advanced, different biological and ethical issues that arise from the emergence and development of the life sciences are still relevant. I am Diolo Cruz, a biological science student from Philippine Normal University, Luzon, and I'll be talking about different kinds or types of assisted reproductive technology and its pros and cons. What should you be aware of about assisted reproductive technology? Assisted reproductive technology refers to reproductive treatments and procedures that can help with fertility issues or inability to have children. Assisted reproductive technology methods entail modifying eggs, sperm, or embryos in order to increase the likelihood of a successful pregnancy. Assisted reproductive technology, or ART, refers to a variety of medical techniques that can assist you in becoming pregnant. In vitro fertilization, or IVF, is the most prevalent method of ART. To fertilize eggs and sperm are combined in a laboratory dish during IVF. After that, some of the fertilized eggs, or what we call the zygotes, are transported to the uterus. Among the other sorts of assisted reproductive technologies are in vitro fertilization, or IVF. Second is Gamete Intrafallopian transfer, or ZIFT. And the third one is Tubal embryo transfer, or DET. And the fourth one is Zygote Intrafallopian transfer, or ZIFT. And the last one is Pronuclear stage Tubal transfer, or what we call PROST. First, we will be talking about in vitro fertilization, or what we call IVF. IVF is a complicated set of techniques designed to improve fertility, avoid genetic abnormalities, and aid in childbirth. During IVF, matured eggs are extracted from the ovaries and fertilized in laboratory using sperm. The fertilized egg or embryos are then transported to the uterus. A whole IVF cycle takes roughly 3 weeks. When the process are divided into sections, the procedure might take longer. The most effective kind of assisted reproductive technology is IVF. The treatment can be performed with the couple's own eggs and sperm. Alternatively, IVF may use eggs and sperm or embryos from a known or anonymous donor. A gestational carrier, or someone who has an embryo implanted in the uterus, or may be employed in some instances. Your doctor can explain how IVF works, the possible dangers, and if this way of treating infertility is suitable for you. So the question is, why it's done? In vitro fertilization, or IVF, is a therapy for infertility or genetic abnormalities. If IVF is used to treat infertility, you and your partner may be able to try less invasive treatments first, such as fertility medications to stimulate egg production or intrauterine insemination, which is meaning a procedure in which sperm are placed directly in the uterus near the time of ovulation. IVF is sometimes used as the primary therapy for infertility in women over the age of 40. If you have specific medical issues, you can also undergo IVF. For example, if you and your partner have this fallopian tube damage or blockage, ovulation disorders, endometriosis, uterine fibroids, previous tubal sterilization or removal, impaired sperm production or function, unexplained infertility, a genetic disorder, or fertility preservation for cancer or other health conditions. Risks of IVF include multiple births, premature delivery and low birth weight, ovarian hyperstimulation syndrome, miscarriage, egg retrieval procedure complications, ectopic pregnancy, birth defects, cancer, or stress. The second one that we will be discussing about the mid-intrafallopian tube transfer or transplantation, or what we call the GIFT. GIFT is a method of assisting pregnancy which includes removing the female egg and sperm and mixing it into the fallopian tube immediately. Unlike in vitro fertilization and intrafallopian tube transplantation, the process of fertilization in the fallopian tube transplantation is in the fallopian tube rather than in the petri dish. However, a healthy fallopian tube is very important for the meat transplantation. So, who can accept Gamete intrafallopian transfer? Gamete intrafallopian tube transfer is suitable for couples haven't explained infertility, IVF without success. Both spouses have religious or ethical factors and cannot accept IVF. Only at least one side of the fallopian tube is healthy. And lastly, husband's sperm quantity and quality. However, according to the National Institute of Health and Wellness, there is insufficient evidence to show that couples with unexplained fertility problems or male factor fertility problems are more likely to use intragamete or in vitro fertilization. And for the pros and cons, because the fertilization happens inside the tubal instead of in the dish, the success rate with GIFT is relatively high. Experts think that the journey through the fallopian tube nourishes the new embryo, giving it a better chance of being healthy and able to implant in the uterus. Another reason for the increased success rate could be timing. The embryo arrives at the right time for implantation, as opposed to IVF, in which the embryo arrives in the uterus when the doctor places it there, and that may not be the right timing for her body. And the third one we will be discussing is about tubal embryo transfer or the TET. TET is similar to GIFT treatment as it's also based on the transfer of embryos. The difference with TET is that the embryos are at a more advanced stage of development when they're transferred than with GIFT. With TET, the embryos are transferred back into the fallopian tubes 2 days after fertilization has taken place in the laboratory. The embryos are at 2-cell or 4-cell stage, whereas in ZIFT, the embryos are transferred back the day after fertilization known as 1-cell or zygote stage. An embryo undergoes cell division as it develops. It starts off as a single cell before dividing into 2 cells, then 4, then 8 cells, and so on, before becoming a blastocyst. A blastocyst is an embryo that has developed for 5 to 6 days after fertilization, reaching around 200 cells and is ready to be implanted into the uterus. So if you are questioning yourself that is TET for me, TET can be offered to women who have at least one healthy open fallopian tube and those who aren't suitable for GIFT or embryo transfer to the vagina, or what we call transvaginal procedure. So another question is, how does TET work? First, fertility medication. You'll be given fertility medication before proceeding with TET to stimulate ovulation. The doctor will monitor your estrogen levels via blood and ultrasound tests. And the second one is egg retrieval and fertilization. Eggs are extracted in the same way as with IVF, GIFT, and other fertility procedures. The eggs are placed in a culture dish in a laboratory along with sperm and allowed to fertilize. This can take a couple of days. And the third one is the implantation. The embryos are then inserted into the fallopian tubes. This is performed as a laparoscopy and involves making a small incision in the abdominal area. Once the embryo have been inserted into the fallopian tubes using pinch or the laparoscope, they're monitored over the next few days to check for signs of pregnancy. A blood test can be done to find out if the treatment's been successful. So if you're questioning again, what are the success rates of TET? The success rates of TET are similar to those of IVF and are higher in younger women than those over 35 years old. What are the risks associated with TET? The risks of TET are similar to those of IVF, ZIFT, and GIFT. There is the potential that you may have a reaction to the fertility medication and a risk of having a multiple pregnancy. The fourth one that we will be discussing about is the zygote Intrafallopian transfer, or the ZIFT. ZIFT, it is assisted reproductive procedure similar to in vitro fertilization and embryo transfer. The difference being that the fertilized embryo is transferred into the fallopian tube instead of the uterus, because the fertilized egg is transferred directly into the tubes. The procedure is also referred to as tubal embryo transfer, or the DAN. This procedure can be more successful than Gamete fallopian transfer, or GIFT, because your physician has a greater chance of ensuring that the egg is fertilized. The woman must have healthy tubes for ZIFT to work. So how is zygote intrafallopian transfer performed? ZIFT is an assisted reproductive procedure that involves the following steps. First is a woman's ovaries are stimulated with medications to increase the probability of producing multiple eggs. And the second one is eggs are then collected through an aspiration procedure. And the third one, those eggs are fertilized in a laboratory procedure identical to IVF, with the exemption of the time frame. During the ZIFT procedure, fertilized eggs are transferred within 24 hours versus 3 to 5 days as used in a regular IVF cycle. And the fourth one, the fertilized eggs are then transferred through a laparoscopic procedure where a catheter is placed deep in the fallopian tube and the fertilized eggs injected. And lastly, the final step is to watch for early pregnancy symptoms, and the fertility specialist will probably use a blood test to determine if pregnancy has occurred. Zygote intrafallopian transfer, or what we call ZIFT, is an assisted reproductive procedure, which means the selected form of treatment for any fertility problems except the following. First is the tubal blockage. Second one is the significant tubal damage. And the third one is an anatomy problem with the uterus, such as severe intrauterine adhesions. And lastly, sperm that is not able to penetrate an egg. So, zygote intrafallopian transfer is commonly chosen by couples who have failed to conceive after at least 1 year of trying and who have failed 5 to 6 cycles of ovarian stimulation with intrauterine insemination, or what we call IUI. So lastly, we will be talking about the Pronuclear stage tubal transfer, or what we call the PROST. The PROST, it is a technique that involves in vitro fertilization, or IVF, of oocytes, followed by the transfer of pronuclear oocytes into the fallopian tubes. It has been developed for its prognostic value of confirming fertilization in couples with oligospermia or astenospermia, and enabling fertilization in cases with anti-spermatozoa antibodies, or what we call ASAD. Pronuclear stage tubal transfer has provided useful diagnostic information in the management of couples who have failed to conceive in other treatment programs, and has particular advantage over IVF for those receiving fresh donated oocytes for ovarian failure. So guys, to sum it up, the high occurrence of multiple births is one of the most problematic issues linked with the use of assisted reproduction. The dangers of multiple births in terms of prenatal death, neonatal difficulties, physical handicap, and cognitive damage are widely known. The World Health Organization has suggested that fewer embryos be transplanted during IVF operations. Numerous scientific advances in recent years have increased our understanding of infertility and equipped us with methods to improve both the efficacy and safety of infertility therapies. Our capacity to overcome low oocyte quality remains unusual. Until we can remove this barrier, we must rely on early and proper detection of infertility and timely treatment, particularly for women in their late 30s and early 40s. Greater understanding of oocyte and embryo biology will lead to future advancements in fertility therapies and maybe the prevention of infertility. So the major goal of the Assisted Reproductive Technology program is to assist childless couples in becoming parents via the use of specialized procedures. So guys, despite having unheard ethical dilemmas, we can advance our understanding of them. Bioethics will help us decipher what is right and what is wrong. Again, I am Cruz, and let me close with two words. Bioethics matters.